we're going to kick off with those right away. We have got interventional radiologist Dr. Ben Paxton with us. Great to have you on, Ben.
Thank you. Nice
All
to be here.
right, yeah, so you're with a vascular and interventional specialist of Prescott. We'll call it VISP for short because
Yes.
that's a long title, and also
Yes.
Prescott Radiologists.
Yes.
So what do you mean by minimally invasive treatments? What would that be like?
Okay. Well, we treat patients, many patients who have cancer, and they can be cancer in many different parts of the body. So, for example, if patients have liver cancer, either primary cancer of the liver or cancer that's spread to the liver, we can treat that with a minimally invasive procedure. That means that it's a tiny incision, a tiny hole, and I can direct a small catheter that's about the size of a piece of spaghetti into the arteries, into the liver, and deliver a treatment directly to the liver.
Okay, that's amazing. Now, what would that have been like before this minimally invasive?
Before this was available, the only treatment would have been either surgery or systemic chemotherapy. But now this
which is poisoning the whole body.
Which is poisoning the whole body. But this is a procedure that we can do directly to the liver. It traps the chemotherapy in the liver and targets only the treatment there in the liver. So there are many fewer side effects to this procedure.
So the specificity, if you will, of just isolating whatever organ the problem, that the cancer is in.
That's right.
That's got to. What kind of difference does that make in terms of how they heal? Or?
It makes a huge difference. It makes a huge difference because the side effects of the treatment are lower than getting chemotherapy in the whole body, and the outcomes are better because you can direct all the treatment right to the liver.
Just right where the problem is.
Yeah,
okay, you have like this Dr. Strangelove scary there.
This is an example of what we can do in the liver. I don't know if you can see this, but these are embolic particles. So they're tiny little particles made of plastic, and these can be coated with chemotherapy. And these little particles are what I can deliver into the liver where the tumors are in the liver.
Unbelievable.
So it stops the blood, these little particles stop the blood flow, and they deliver chemotherapy right into the liver. So that's one type of minimally invasive therapy that we can do.
Now, they're around the plastic and stuff, so does that eventually dissolve or just work its way out after the chemo portion has done its thing?
Usually they're permanent. Usually they block the arteries off permanently. Yeah.
Oh, okay. Is that important to do? I mean, it helps, doesn't help. I don't know.
It's not good for the tumor. It kills the tumor.
Yeah.
It doesn't hurt the liver because the liver has multiple types of blood flow to it.
Oh, okay. Yeah. Wow.
So it's a treatment that just targets the tumors that are in the liver.
And is this new? Is this kind of a new technology?
It is newer. It's been around, for 10 or 20 years, but in the past 5 or 10 years, it's really kind of taken off, and there are a lot of different types of treatments like this that we can do.
And they just keep making things better and better and better. I mean, like you said, in previous to this, it would be they have to poison your whole body. Now, I know chemotherapy, I mean, obviously it's a big chance for healing with cancer. I mean, it's just like our best chance. But it's self-poisonous, so that also, in terms of your immune system, this has got to be a whole lot better.
It is better. It is better because it just puts the chemotherapy agent right into the liver. So there are many fewer side effects.
What other kinds of cancers? Because maybe not can.
Sure.
I'm guessing that not all cancer can be treated this way.
That's correct. That's correct. And not all. We can't treat all types of cancers, but there are some other cancers that we can treat. Another thing we can do is called ablation. It basically uses a long needle, and we direct the needle into the cancer under CT. There's a gas that's put through the needle, and it causes an ice ball at the tip of the needle. So anything within that ice ball is killed.
It freezes it.
It freezes it. So anything within the ice ball is frozen and killed. So for instance, if someone has kidney cancer, in some cases, I can put a needle into the kidney cancer, it forms an ice ball, and it kills the kidney cancer.
So there's no way to, once you realize in a certain part, you can't heal that part. You just need to get the cancer to contain it.
That's right.
To stop it from
That's
spreading.
Right. So that's right. So instead of going to surgery to remove the entire kidney, I can put a needle in there and have an ice ball and just kill the cancer.
That is amazing. Are these the two main non-invasive? Are there other types?
Those are kind of the two main ones that we do. Yeah.
Gosh,
here at the hospital.
this is so fascinating. And then what about are there other kinds of cancer that you can use these two treatments with?
Yes, some lung cancers we can freeze, and some cancers in bone we can freeze.
In bone?
In bone. So if someone has a painful metastasis to their bones, we can put a needle into the bone and freeze that metastasis to relieve pain.
Wow, I think that's amazing.
Yeah.
So does that take the place of things like transplants sometimes if you can catch it early with a freezing? Or?
Not so much. It depends on the patient's case and
Right.
the whole situation.
But this has got to be a great tool for doctors.
It is a great tool, and it's a great tool for those in the community who have these conditions. In years past, patients would have to travel long distance, maybe to Phoenix to get some of these treatments. But now they're available, here in our hometown. Patients can stay, in their homes with their families where they're more comfortable and get these treatments here in town, which is a great thing for patients here in the
Oh, I
community.
tell you, that's amazing because number one, if you're feeling sick or you are sick,
Exactly.
last thing you want to have to do is
Exactly.
be traveling far away
Exactly.
from home.
Exactly.
Are these things when you do this, is it kind of, it seems like so many things are outpatient now. Is it almost like an outpatient procedure?
Yes, most of them are. Most of them are.
Wow, I tell you, that's phenomenal.
It is, yeah.
And you've seen some pretty good results with this, have you?
Yeah, yeah. I mean, some patients who come to me with kidney cancers, it feels really good to say, yeah, I can cure your kidney cancer with an outpatient procedure, whereas in years past they would have had to go to surgery and have a long recovery time from that surgery. So a lot of these treatments are really, fun to do, and they're great for patients.
Well, and you think about, like you mentioned, the kidney, to still retain your kidney, not have to have it taken out, because any kind of surgery like that is major. It affects your whole system
yeah.
in terms of recovery,
Sure.
anesthesia's hard on your body, all
sure.
that. So you prevent that, you keep your kidney, and only a part of it is like
That's
knocked
right.
out, the bad part.
That's right.
Phenomenal.
Exactly.
Well, this is really good news. Wow, minimally invasive cancer treatment options. Love it. You can find out more, obviously, vascular and interventional specialist at Prescott and Prescott Radiology if you
Yes.
need that kind of help.
That's right. Yeah, call us anytime.
Awesome. Dr. Ben Paxton, thanks so much for joining us.
Thank you.
Good news. I like what you had to say.